Hey nurses in Massachusetts, my name is Kathy Hughes and I'm a registered nurse in California for over 25 years. I'm also the executive director of SEIU Nurse Alliance of California, representing about 35,000 nurses across the state. SEIU nurses were instrumental in getting our safe patient limits passed, and they've been in effect since 2004. I'm hearing that your employers and hospitals are spreading rumors and using the same scare tactics as they did with us back in the day. Well, I'm here to set the record straight. Mind you, I'm just a nurse who worked at the bedside for many years and represent nurses now who continue to do that same work. No hospitals closed and no services ended as a result of our law being passed. As a matter of fact, our hospitals continue to show record profits. I'm also happy to say that many nurses return to the bedside after having left or gone part-time due to burnout or the stress of working in unsafe staffing conditions. Nurses returning to the bedside also resulted in helping us solve our nursing shortage, so win-win. Our patients win too, because patient morbidity and mortality rates go down when safer staffing is in place. In fact, because now we staff based on acuity and nursing care needs, hospitals can adjust their staffing to improve patient care and outcomes. That's because it isn't a one-size-fits-all staffing system, and employers can't continue to staff down just to save money at the cost of patient care and safety. And let's be real, whatever costs may have been incurred have been more than made up for with improved patient care, lower readmissions, and fewer complications here in California, and that would hold true for you in Massachusetts. I wanted to take just a minute to talk about the ER. Because we have safer staffing, we're able to better care for our ED patients and move them through to discharge or admission in a more effective way. It improves on patient flow. Having improved staffing is not the reason why our ERs are getting backed up. We had beds in med-surg, telemetry, labor and delivery, etc. We just didn't have enough nurses to staff them. Now we do, and our ER staff have a place to move patients instead of boarding them in the ER so often. Now we start each shift on every hospital unit with enough staff for all of our patients, and our employers now have plans in place to address fluctuations in census and acuity changes. And that's why I and all California nurses support the Patient Safety Act for Massachusetts and say yes on one. Thanks for having me, and say yes on one.